Hello, everybody. Today we're going to be talking about how cross culture affects our communication. I'm Daisy Sedeno. I'm a bilingual communications coach. I'm a broadcaster, podcaster, and also a multimedia journalist. And today we have a guest, Jessica Bravo. She's a modern social worker, macro practitioner. She's Latina, licensed clinical social worker, and she's here with us today. Let me put her
Hello.
on. Let me put her on the screen. Yes, there she is. How you
Hello.
doing?
Hi, I'm doing good. How are you, Daisy?
Great. First, tell everybody what is this about being a macro social worker, so people understand.
Yeah, so a macro social worker is somebody who is more involved in the community. So since I'm Latina, I'm especially involved in the Latina community, our own issues, our barriers specific to our culture and our heritage. And then I also do work at the policy level advocating for different changes that affect our culture specifically.
Fantastic. And also, a licensed clinical social worker. You work directly with patients. Explain a
Yes.
little bit of
Uh-huh.
that.
Yeah, so a licensed clinical social worker is, you can think about it as a therapist or a clinician. So we're licensed to do clinical work in the mental health field. So that involves behavioral health, psychiatric hospitals, outpatient therapy. So we're able to provide psychological services. But social work uses a biopsychosocial lens. So we
Mm-hmm.
look at all of the aspects of a person instead of just the psychology. So we
Mm-hmm.
don't so much target pathology like they do in psychology. We look at biopsychosocial. So all of the factors in the society that the person is dealing with, and individual stuff and genetics and things like that. So it's a more comprehensive look at an individual's mental health.
Fantastic. What is communication has anything to do with culture and vice versa? Because
Yeah.
sometimes we don't even think how culture can impact the interaction when it comes to understanding each
Hmm.
other. Let's go to that part
Yeah.
first.
Yeah, so culture is all of our learned values and beliefs that come from the people that we grow up with, the culture that the environment really that we're a part of. And culture is learned at a very early age, and it is acted out, transmitted, and preserved through communication. So culture and communication are interconnected and they work within one each other. So when we're communicating, part of our culture comes out in our communications and the things that we will talk about, how we talked about them, the tone, our personal beliefs are all shaped by our individual culture.
It's incredible that we haven't talked about this like maybe 50 years ago, 60 years ago. It's like a new topic for
Hmm.
some people. And I think that can transform a company, it can transform an interaction
Hmm.
with your boss, your leadership, your people in
Hmm.
leadership, and to bring more people from different backgrounds to leadership, because sometimes it's that element
Hmm.
that we are not understanding how we communicate with each other within a culture, within a pocket of the same
Hmm.
community. In your perspective as a Latina, how culture, I mean, you had to learn how to be able to navigate both worlds since you were little.
Hmm. Yeah. So cultural sensitivity has been a big thing lately, and you're so right. Like this is something that was completely overlooked years ago, and
Mhm.
is a big factor in our communication, especially as Latinas. And it's a big factor that plays a part in how we communicate and the things that we're willing to do as far as work and how far are we willing to go because we're so underrepresented at the higher levels, right? In
Mhm.
culture, I believe it plays a huge part because within the Latina culture, um, there is a hierarchy, right? So we look at males and uh, specifically white males as being the top, and then we're at the bottom. So we don't ever even allow ourselves to go to those higher roles. In
Mhm.
our culture plays a big factor in whether we're willing to do that or not because we learn that as women we serve, we're not in positions of leadership. So now like having that awareness and that understanding and being willing to step out of that and go into higher levels where we can represent our people, where we can talk about our specific issues, because the issues that we have as a Latina community is very different from somebody who is white or somebody who is African American or somebody who is Indian, or regardless of the race and the ethnicity, our our issues are very specific and tied to our individual culture.
Yes, and you talked about gender a little bit, but the
Hmm.
combination of culture, education, upbringing, and gender, it's powerful to understand. It's an opportunity for growth. And you talked about maybe interacting with another race, but within our own race, to be a leader, usually males are more
Hmm.
perceived as the head of any company, any situation, any problem. You look for that authority figure that is usually male represented by.
Hmm.
But when it comes to, it's another step when it comes to interacting with other cultures. Within our own culture as Latinas, we have that issue to just step up into leadership.
Hmm.
But when it comes to interacting with other cultures, a little bit like, okay, this is bigger. I have to believe
Hmm.
a couple other things. I have to change a couple other things.
Hmm.
How do you feel about the combination of education also and gender in the upbringing?
Yeah. So our upbringing teaches us who we are and the things that we are capable of doing, right? So if
Mhm,
in our upbringing we learn that we're not capable or we shouldn't be in leadership positions, then it's going to take a lot of undoing in our adult life for us to be able to step into those higher roles. And in the Latina culture, is those roles, like you said, are specifically set aside for the males, for men to take power and to
mhm,
lead the culture, and it shows in our it affects our work in the topics that we're willing to discuss, especially when it comes to dealing with men. Like for example, at the
mhm,
hospital, most of the psychiatrists are men, right? And think about if it's somebody from a minority background like myself, I am more likely to be open with them and tell them if I disagree with their diagnoses or if I disagree with the perspective that they're taking on a specific
mhm,
patient. Now, if you have a male doctor who is white, uh, we are less likely, and I hate to say this, but it is the reality. We're less
mhm,
likely to question their diagnosis and to question their power. Um, and in healthcare, we like to say that there is no hierarchy, but there is a hierarchy. And our culture plays a huge part in that because we don't believe that we have the power to even question a man, right? It's easier for
mhm.
us to communicate with women or with other minorities and kind of talk about like what our perspective is, what our professional opinion is, like what we think this person's diagnosis is. But we're not as likely to have those conversations with male doctors, specifically those who are white. We just don't feel like that is our role. And
It's
again,
incredible.
because those are usually taken by men.
Hmm. And it has, sometimes we're talking about very general. We don't want to stereotype. We're talking about
Mm-hmm.
statistics, numbers that we're seeing, and it's part of the reality for some communities. For example, I've seen it that there's people that when they see a doctor as a female, they said, "Are you a nurse?
Yeah. Yeah,
Are you
you're
a
so
nurse?"
right. And that happens all the time. That happens all the time. And I get that all the time at the hospital. I'm a psychotherapist. But as soon as a male patient sees me, they're like, "Oh, are you a nurse?" And we wear different
Yes.
scrubs, we wear different colors. So that identifies our role.
Uh-huh.
And we're often confused with nurses. Anybody who is a female who is in those kind of positions are
Yes.
often mistaken for a nurse.
Yes, and I think we have to change. It's like a collective
Mm-hmm.
conscience. It's a little bit. It
Yeah.
goes a little bit more deep into,
Mm-hmm.
what we can do for one person. It's a very collective. And when it comes to doing interviews, when it's time to get a job, when it's time to just be in an interaction with people in leadership, the same
Mm-hmm.
situation is all about perception. When we go to an interview and we have a female or a male doing the interview for us, we kind of adjust ourselves,
Mm-hmm.
expecting this and that, right?
Right, exactly. So the topics that we're willing to discuss, the phrases, the words, our physical gestures, our body language is a lot different when we're interacting with men than it is when we're interacting with women. And the race also comes in play. You know, if you're dealing with minority women that are interviewing you, I can say that personally, I feel more comfortable and I feel more able to show like different parts of my culture and who I am and the beliefs that I bring into my practice, as
Mhm.
opposed to if I was being interviewed by a group of white women or men.
Exactly. Well, we are talking about how culture affects our communications. I'm Latina. I've been in both worlds. I've been able to navigate both worlds. Of course, my forte is in Spanish. This is what I do for
Mhm.
living in broadcasting. And every now and then I will do stuff in English, but I see the difference. When I navigate between the two worlds, I see the
Mhm.
perception change. I see a couple things. And we want to give a couple of strategies to the people that are watching this video podcast, because at the same time, it's information is power. That's what I want to
Mhm.
just leave out there. When we know that we have those bias or the things that we need to work on, or we perceive that somebody else has an expectation, just because I'm this and this, you're expecting me to act this way. So let me open your world. How can I
Mhm.
just expand your perception of reality, because you have a perception of me that maybe is not why what I want to do. So
Mhm.
let's give a couple of strategies. You have navigated between the two worlds, not only at
Mhm.
work but family interaction. There's a
Mhm.
whole beautiful melting pot within our own pockets
Mhm.
that
Yeah.
it's beautiful. So let's give a couple of strategies as a Latina, as a professional Latina, being in this wonderful country, United States.
Yeah. I think the most important tip that any of us can learn is to get curious. Get curious about the way that we communicate with others at work and how our individual beliefs and our culture is playing a part in that. And what I mean by get curious, if you see that when you're talking to somebody in a higher role, and whether they're male or female, think about your body language and how you're responding, and you can tell like when you start getting anxiety, like your chest tightens up, like why are you, like ask yourself, get curious about where that anxiety is coming from, because it's telling you something. And you can notice how it's different depending on the person that you're interacting with, and be like, what is it that is coming up for me that is not letting me communicate my message? And I know with the Latinx community, the language barrier also comes into play. So we have an accent. The way we say things in Spanish doesn't always translate to English. And I find myself doing that a lot, where I translate instead of interpret. So when we translate something, it may not mean the same thing in English. And we find ourselves in those positions where we may feel uncomfortable. But it's okay. Like, get curious about like where that uncomfort is coming from, and owning that power. Like, you are Latina, you are whatever culture you identify with, right? And what things are coming up for me, and what value do I bring to this conversation? We bring a different perspective. Our cultural lens is completely different from somebody else's point of view, and there is value in that. Not only for our community, but for other communities as well, for there to be more awareness, more understanding, and to kind of clarify some topics that to another culture may be something that is not. And what I'm trying to say with that is like a lot of the communication um, barriers come to misunderstandings because we see the world very differently. So first, like owning that and being proud in who you are, and knowing that there are going to be some conflicts, that there's going to be some misunderstandings, but there's beauty in that. There's beauty in addressing those issues and the misunderstandings, so that there's better communication on both sides and there's a better understanding. And that's not only helping you, that's helping all of our community. Like when you're bringing those things up, like you're opening up somebody else's perspective to your world.
Yes, I love that you said get curious, stay curious, just be open to learn. Because one of the things that we do as a Latino community overall is that we create our own pockets that we don't move from there. And it's
Yeah.
beautiful when you go to a town and you know where the little bodega is, because you know that's where
Yeah.
people are. And it's okay. But there's an opportunity to just get out of that, to interact for business,
Mm-hmm.
for professional development, to grow within this wonderful country. It's an opportunity. So sometimes we are so concerned about not being ourselves that we just
Mm-hmm.
hide. And that's how I see it. Not everybody, I don't want to generalize, I don't want to put a
Mm-hmm.
stereotype, but we hide, we just stay in our place. And today, that's what we want to open this opportunity to talk
Mm-hmm.
about this. We can navigate between two worlds. We have two Latinas that have done it. We
Mm-hmm.
Jessica, of course, and me working in both worlds, and there's an
Mm-hmm.
opportunity for both of us because we are able to connect with two different communities and just show up. Show up
Mhm.
the way that you are. Like you said,
Yeah.
just concentrate on what you bring to the table. And I want to add that maybe we just need to pause. We are so in a rush to judge or to put a label on something, or the way that this person is treating me is because of this and that. Just be
Mhm.
open, like she said, get curious, pause and observe. And
Mhm.
there's a lot of things that can come into place. Misperception. Remember that we come from different backgrounds, that the way that I perceive something maybe is not the same that the other person perceives. I was reading something about low context cultures and open cultures, like very, very dense cultures. Like, for example, there are some cultures that explain everything. High context cultures.
Mhm.
They explain everything. They're very specific about everything. And in other cultures, they are very, how would you say it? Like everything's supposed to be implicit.
Mhm. Yeah.
And you, what you mean you don't know? What you mean you don't understand? That's part of, that's the way it's been. That's the way it's been done for so many years. It's like we have to understand that too.
Mhm. And culture plays, I mean, I love what you said, that's very powerful, but it plays a huge part. And it makes me think, as when we have doctors from different ethnic backgrounds, the way they communicate with the patient's family is very different. So some cultures are, like you said, very high context. They explain everything, why they say things the way they do, and what they mean by those words, especially in healthcare. But there is other cultures, our culture, like, of course, comes into play when we're communicating with patients. And there's other cultures that are very blunt and very cut dry, and if you're dealing with a different culture, they may not receive that very well. And they may even look at it as you're being rude, or that is not the higher level of care. But we have to see where our culture plays a factor. Like you said, some cultures, things are implied, right? Things that we already know. There are some cultures that are more prone to not sugarcoating anything and just saying things how they are. And they don't take that personal, right? But somebody who comes from a different culture, who is more sensitive to the words that are used, the way that things are said, may be offended by
Yes.
somebody communicating this way. They'd be like, well, like,
Yeah.
what do you mean? Let's think about weight. If they're talking about weight, like, that's a very sensitive topic that has to do with our body image, right? And most people are hold that close to their hearts, right? So anything that you say
Yes.
about weight, you got to be careful the way you word it and the way you say it, because you can hurt somebody's feelings, you can trigger something. Um, and if you have a practitioner who is not culturally sensitive to those
Mm.
things, they may just be like blunt and be like, well, you're obese. You need to um, eat better. You need to eat less. Like, how would that come across? Like, we don't see the other person's culture perspective and how they may take this and how this may trigger something. And there will be a lot of misunderstandings. Like, if we just
Yes.
pause, like you said, for a second, pause and be
Exactly.
like, okay, this was hurtful, but I don't know,
What is
like,
that
this
coming
person's
from?
background.
Yeah.
Right. Yeah.
Yeah.
Yeah. And
And it's an
it's really
opportunity.
just pausing. Yeah. It's an
Exactly.
opportunity. Is really just pausing and be like, okay, let me take my feelings per se out of it. Like, this is the way it makes me feel, and I can address that and be like, look, when you say these things in a certain way, it makes me feel this way, so it's going to make me resistant to treatment. It's going to make me not want to address the issue, and it's going to make me not want to open up about my health issues with you, because you've already triggered this thing that makes me feel this way. So
Yes.
saying those things to the people that are treating you, to the provider, so that they know moving forward, like, okay, maybe I need to address this a little differently. Maybe it's not
Exactly.
something that is sensitive in my culture, but it is sensitive in other people's culture. And I have to make sure that if I want to really help this person and provide the best level of care, that I take those
Mhm.
things into consideration when I'm treating them.
And I love that this topic is being taught already in schools, at
Hmm.
work, in training, because this is very important for the team, for the interaction, for the productivity. Even to look at
Hmm.
somebody directly in their eyes could be taken as a threat. For some cultures, it's that's the way it is.
Yeah.
It's
Hmm.
the way that we are maybe moving our hands too much. For Latinos, Italians, French,
We talk with our
it's
hands.
normal. We talk with our hands, but
Yeah.
for somebody, ooh, she's a little bit aggressive. It can be perceived
Yeah.
as that. And to understand who is your audience when you're doing a presentation, when you're doing
Hmm.
an interaction like Jessica does with different cultures, just to understand who I have in front of me, to be
Hmm.
able to communicate in a way that I can get through. Because at the end of the day, we're having a dialogue. It's not me just shooting words and this is what you're going to do and that's it. I need to perceive what's going on to make it a productive interaction.
Hmm.
So
Yeah.
I'm so glad that we were able to talk about this topic. You're doing a great job. And do you want to tell a last message for everybody when it comes to cross culture communication?
Yeah, I want to say something on cultural sensitivity because it could be like that big bear in the room that you don't want to address. I think the biggest thing is really just being willing to have those conversations and step out of your comfort zone and understand that when you don't understand somebody else's culture or how they perceive things, that it's okay to be like, look, I'm sorry, I am not familiar with the things that you find offensive. So can you please explain? Can you tell me like what is it that what things can I say or can I say, and how do you perceive that? Like just being open to having those conversations, because that's what cultural sensitivity is all about: is learning that the different cultures perceive things differently, and be willing to get uncomfortable, right? So that's when we
Yes.
grow, when we step out of our comfort zone, when
Mhm.
we're willing to step into the discomfort and be like, okay, this may be a little bit uncomfortable, but you're going to learn and get so much out of it for yourself. And it's just lifelong learning. That's what we
I
do.
love it. I love it. I love it. Today we talked about how cross culture affects our communication. Until next time.